Hi, Stephanie.
Hi there.
Hi, Dr. Mills. Long time no see.
I was going to give it just another minute or so to start promptly at 1.
Perfect.
And Margaret Thompson is on.
Can you hear me now, Marcy?
Yeah.
I
Can you hear me, Margaret Thompson?
Yep.
Yes.
And we can hear you.
Okay.
Thank you.
Thank you both for being here.
Oh boy, what did I do? Okay, so I did something. Not sure what I did. Okay, better.
All right, still having a couple of people log on, so we'll give it just another minute here. All right, well, I have 1 o'clock. So Stephanie Coleman here. I just want to thank everybody for joining us today. Welcome. I think there's a lot of interest in this group. I've seen this group come up in a lot of news articles from across the state. I think Marcy may have emailed out a couple of links in reference to this group. So certainly seems to be big interest across our state. Definitely the work that we're doing, the data that's being collected. So I want to thank you guys for being here and for participating with us today. And I think we'll have some time here in a little bit to have more open discussion around some of the data that gets presented. Jen, I don't know if you have anything you want to say.
Hi, great to have everybody here. Again, we understand that everybody's busy and we want to make sure that we're making the best use of your time. So we're going to go over data today, and then we're going to have a great discussion. Like Dr. Coleman said, I do believe that there's great interest in what we're doing. On the personal side of things, you know, my kids have already gone into remote learning once this school year. And so, you know, we want to keep the kids in school, want to keep them safe though, while they're in school. And of course that comes above everything, is to keep our kids safe and healthy. But we know we all have both professional and personal interest in making sure that we can guide our state through the school year. So thank you again for being here.
Thank you. I think one other comment before I turn it over to Marcy. I think also you guys should have received an email for a file share that we can save this data, save information on. So just know that exists, and we'll be able to hopefully pass information back and forth. And I appreciate the email that Dr. Hubbard had sent with her resources as well. So hopefully we'll have a way to kind of share information among members of this group. Okay, Marcy, I think, do you want to?
I am ready. And I think Dominique is driving, so I'm going to have her hop through the next few slides. We added a slide as a reminder what the work group's goals are. We are meeting weekly now because the picture is changing weekly, but we will keep close tabs on all of this data and may may ultimately wind up meeting biweekly. But that requires us to sort of meet our goals around managing COVID in schools. And on that note, next slide. Many of these metrics will look familiar to you. We're going to try to get into a cadence so that you can expect to see the same sorts of metrics and give you a sense of what's happening in our state. These are the metrics that we track closely in the governor's office. Of course, starting with cases, which, as you know, have been rising significantly over the course of the summer. Deaths follow cases, and we don't have hospitalization here, but we'll talk about that more in a moment. So cases going up, deaths going up. Of course, we are trying to get as many folks to take advantage of testing, and certainly the testing programs that are being utilized in Kansas schools, I think are showing some real benefits. We'll talk about that more in a moment. We have seen a slump in vaccinations after Labor Day weekend. And so to the extent that this group inspires folks to take any particular action, certainly getting vaccinated would be at the top of that list. So next slide. We have a couple of different ways that we track data, and forgive me, we're going to get through the slides fairly quickly and then take the slides down and let folks have a conversation about the implications of this information. But we do track hotspots across the state. Thank you, Dominique. The national, no, you're good. We're tracking carefully vaccination in the 12 to 17-year-old group. Of course, these are kids in schools. And at this point, Kansas continues to be 7 to 8% behind national vaccination rates. So this too is a top priority of the governor, hopefully of this group, to get shots in arms and prevent outbreaks in schools. And I'm going to share some of that data with you here in a moment. Dominique, if you want to hit the next slide. Just as a reminder, there are 3 major tools that we have to keep schools open safely. There are several other kinds of ways in which we can promote safety in schools, certainly getting access to better ventilation, and ensuring that surfaces are clean. But the 3 major tools are vaccination, testing, and masking. So those are the data that we'll be wanting to share with this group. You'll see a flag here that will be an important conversation for this group to have, and that is that the FDA has granted emergency use authorization, or is in the process of looking at the data so that we could get full FDA approval for the Pfizer for those 16 years of age and older. And that's just going to be really important. We are hoping to see that by the end of September, that Pfizer's data will be submitted for those who are age 5 to 11, and that it could be potentially by the beginning of November, end of October, that we can be vaccinating youth. That will change the game here significantly. And I'm going to leave it to my pediatrician experts to talk more about that in a moment. So next slide. We are going to have a whole host of information ready to share with you, I believe, by next week. Today, I'm going to share information with you by county, but we are also carving up the data by school district, which I think will be very, very useful for parents and for teachers and communities across the state. But when you look at the youth vaccination rates by county, you can see here the darker blue counties have had more success in getting kids aged 12 to 17 years vaccinated. And there's some pretty significant variation by county. So room for growth here, room for improvement. Next slide. I'd mentioned vaccination first, testing next, and masking is the three major tools. So looking specifically at testing, we had an opportunity to hear from Dr. Farah Ahmed last week. I know Farah is joining us today so that we can address any of the follow-up questions or concerns that the members today might have. But Kansas is one of a group of states that's really leading the country in testing out a model that keeps kids safe in schools. So you can, if you look in the media, you can see reports from Utah or from Massachusetts. But a real hats off to Farah and Dr. Joan Duvey and their teams for the leadership that we're showing around testing. Now, we have a testing program in place for schools to take advantage of, but as you can see, we don't have all of our school districts yet interested. We have seen a growth since last week in terms of school districts that have either drafted, submitted, or approved their a testing program. We still have about 12% not responding, and about 11% of our schools not yet interested in testing. So our job, I think, is to explain what testing is, why it can keep kids safe, and talk about ways in which testing is and isn't candidly working in Kansas schools. In addition to tracking by school district, you can see here we're also tracking by the number of children that are impacted. In other words, have the benefit of using these tests every week. And you can see here in terms of takeaways, last week, a total of 19% of students across Kansas have attended a school that wasn't doing testing and not interested in testing. So again, our work is cut out for us. Next slide. In terms of those school districts that are reporting, here you can see the kinds of tests. I don't know if it will be useful, but I think there are a couple of nice models for those not as familiar with the kinds of testing that we do in schools. PCR versus antigen testing. Antigen tests are far easier to share among students. They are less expensive. The federal government has really been advocating the use of antigen tests, but they are less accurate than PCR tests, which are used for diagnosis. Having said that, we've got about 100 districts that have been taking advantage of testing. And you can see here 800 total cases of COVID in 74 districts. We are certain that there will be more to come given how infectious Delta is. But as I mentioned, in the coming weeks, we'll have data for you by school district and can pinpoint for you what that looks like. Next slide. I promise I'm almost done. Vaccination, testing, masking. So taking a look at the number of school districts that have mask mandates, looking at the number of schools that encourage but don't require masks, but really the majority of schools, we're still in the dark about whether or not they are testing. And I know we're going to hear from Dr. Randy Watson in a moment. We know that he is intending to help us on getting answers to this survey so that we have a really clear sense of who is testing and where that testing occurs. It's important data to have, particularly when you contrast that with where we're seeing outbreaks. So next slide. Next slide. We provide that last one in the event that folks may not be familiar with how KDHE tracks outbreaks by school. But here we did want to share with you that in terms of active outbreaks, and this was as of September 17th, we are, I believe, up to 72 in Kansas as of this morning. But you can see here that in those school districts where their masks are required, it appears that there are fewer active outbreaks as we might hope and suspect. Having said that, there is still a significant number of schools, as I mentioned, where we don't yet know what kind of masking policy they're advocating. We do know that there is a lot of controversy around this topic. We sent a couple of articles that were in the media this week. We know that this is not an easy topic for schools to manage, for families to manage, for providers to manage. And I hope in our conversation today, we might talk a little bit about that and how many of you are dealing with this and recommending that families and teachers and school communities deal with this. Next slide. I'm going to get through this next set of slides very quickly, but I wanted to make sure that everyone who was a member of this group understood that KDHE and the governor's office is really trying to pull out all the stops to make information about what's happening relative to COVID as easy to understand as possible. There are just so many conflicting reports and a fair amount of misinformation out there. So we have put together what we call the Kansas County COVID rankings. We look at vaccination rate, COVID cases, tests given, and then if you hop to the next slide, Dominique, and you'll all have this in your slides, so I'm not going to dive into this in great detail, but you can see what we're trying to do is rank counties by each of these measures so that they can have a sense of what is happening in surrounding counties, have a sense of which counties are maybe doing very well, and there may be best practices to share. But most importantly, empowering local leaders to understand where they sit and what they can do to improve their overall county ranking. And so you can see the far right in the pink, we are providing an actual rank 1 through 105. And then next slide. We include this information also in a map. A couple of things I would point out for you here. So at this point, Kansas has, we're at 60% of vaccination for the eligible population. That puts us at 29th in the country. But as you can see, there is significant variation by county. I do want to flag that Kansas is still very much at risk, even in those places where we know they're doing pretty well with vaccination. 98% of our counties still fall into a high or substantial risk of COVID transmission. So again, what happens in one county, very important, but is connected to the activities in other counties and absolutely connected back to schools, school districts, and local leaders. And so next slide. I would want folks to know we are trying to provide as many resources to help communities. You'll note here under testing, we have a link to the 74 million, and actually I think that was bumped up to 89 million when you add a couple different testing opportunities for pre-K through 12 for schools to get access to resources to help them do testing. There's also a very cool and convenient map on testing that helps members of the community understand where they can go to get tests. And then next slide, which I think actually is our opportunity to maybe take the slides down for a bit and have Dr. Watson give us a bit of an overview, and then back to Stephanie and Jen to lead the dialogue.
Good afternoon, everyone. Where you can see that shows me as G.A. Bowie. I'm sharing his computer because we're in Wichita right now. And Everyone in another room decided to get on the internet, and I apologize, but it dropped me completely. So he's on a hotspot and graciously came over and shared his computer. We are working hard to get the data correct to all of you. So I spoke to them in general about a lot of data requests that we're getting from our agency, from KDHE, and the importance of making sure that's correct. We're also having some from the federal government related to ESSER funds and EANS funding. So they're getting a lot of data requests. They know that you're working hard to make good policy, and to make good policy, we have to have accurate, especially data on masking. So when we're showing over half of no responses to that, I think we'll see that improve over the next couple of weeks. I hope that we do. We had a great presentation from a couple of school districts that are doing testing, and talked about the ease of use. So thank you, KDHE. They give a lot of kudos to KDHE for how much assistance they had in the grant formulation. They both were doing it different, but within what their county wanted to do. One was in far southwestern Kansas, and one was in more of the central northeast part of the state. But I think we will also see the no responses there, while the number's certainly less than masking. I think we'll see that pick up. And then I think we were at about 11% not participating in testing, or maybe that was the other way around. But I think you're going to see more and more people decide to test, as it's a great alternative to stay in school. One superintendent noted how many instructional days he had saved in his community by simply doing the testing protocol. So I think that that's been well received. We also talked briefly about vaccinations probably coming for younger children, maybe by the end of the semester, and to start to work with county health officers on a plan for how we may roll that out, knowing that would be flu season, and knowing that possibly the current variant and the exposure rates may even go up as we get into the winter. A lot of unforeseen there, and I know vaccinations and policies play a huge role in that. All that being said, I will tell you that communities continue to be splintered and being shown at board meetings. I know many of you in your local communities feel that. That's tremendous pressure on school people and school board members. I might just say, for school board members, that's a non-paid volunteer position. Many just parents wanting to do the right thing, and they really do want to do the right thing, but loud voices are wanting, of course, no mask policies, and in some cases, not testing. But we're making progress on both of those. On an extremely sad note, I was just informed literally before I walked into this other room to join you that we did have a student, a middle school student, pass away of COVID just in the last maybe day. And I know that may not even be on statistic. Those are the type of things we're working hard to make sure it does not happen while we keep schools open, right? It's keeping them open and safe. So again, I appreciate all of your efforts. Please continue to let me know, and GA, who I'm using his computer, but he's here, how we can assist in trying to continue to get accurate information out, and to give you the data that this group needs in order to make good policy decisions. So with that, Marcy and Dr. Coleman, Dr. McKinney, I would stand for any questions or other discussion you'd like to have with me, or to go on with other people.
It doesn't like we. Oh, sorry. Go ahead, Stephanie.
Oh, I was saying, it looks like there's a question in the chat box asking if it's possible to have access to the superintendent presentation that talked about the instructional days saved. So the presentation that you talked about around testing.
I don't know if that was recorded, but I can get you in contact with the superintendent, who I'm sure can share that data with us.
One question I have for you, Randy, as I look at what's happening in other states who are testing out this model, and Farah might be able to speak to this as well. One of the things to make this model work is that the school has to be pretty organized and has to sort of know what it's doing, and it can be resource intensive. And so I know that we have hired at KDHE 10 full-time project managers to help schools across the state. But Randy, are you hearing from superintendents that they're struggling at all on the workforce end, just to have folks who can help schools piece this together?
I've heard both. So I think it's both. And I think it's a fair balance. Those that plan their grants appropriately, staffed it appropriately. And KDHE's been really good about amending grants and doing that. But again, we heard where a school district that had multiple communities in different towns, they even leased a car, hired people to travel between the sites, hired additional administrative assistants to handle the paperwork. That seemed to be going well. Where it's been left simply to a principal and a nurse, they're getting overwhelmed and with just the volume and then the pressure. I also shared with KDHE just late last week. We have one superintendent in Central Kansas really trying to do the right work and a lot of testing, getting some pushback now on the volume of testing with young kids, and they're the younger kids, some saying, becoming very anxious about whether or not they're going to test out and have the virus. And so there's some mental health going on with that too. But short answer, Marcy, it's a mixed bag depending on how they wrote the grant to be staffed. So I think we're going to also be talking to them about make sure as you write your grant or amend your grant with KDHE, you're going to have to staff that appropriately. You're not going to be probably able to do it over the long term with just a principal and one school nurse.
I'll chime in and just to give a little more detail on what those project specialists are doing. So we hired a program manager to oversee just this whole K through 12 testing funding. And then under her are the 10 program managers, program specialists. And really the intention was they've got a group of school districts, they reach out to them, conversations about what they think a testing workflow might look like and what they think they might need as far as resources, including people. And the program specialists are really trying to, be like, well, are you sure that you can handle it with just half an FTE? And from their experience are trying to, let school districts know that it is operationally a big lift, but thankfully the funds are pretty flexible to what Randy said, like you can lease cars, you can hire temps, you can hire contract workers, you can hire staff. And so yeah, where it's going well, but it is operationally a lift.
Is there any kind of like blueprint for schools based on the size of their district? Recommended No, short answer, no, not exactly, because every school district, because we did a pilot with about 11 school districts over the summer, and we quickly realized like there was no point in having a blueprint because everyone wanted to do something different. Sure. From who they wanted to test to how often they wanted to test, like who was going to test or observe, and the physical workflow, everyone wanted something different. So what we've tried to do is arm our specialists with on the ground experience where they've seen different, because we do mass testing sites, right? And have kind of helped them try to lessons learned from that kind of stuff. But other than that, we kind of take direction from the schools on what they want to try to accomplish.
Having said that, Farah, are you tapped into any kind of national network? When I look at whatever reports we're getting in about the test to stay program that's happening in Massachusetts and Utah, the early data seems to be quite successful. Back to Randy's point about mental health, the best thing we can do for our kids is keep them in school. So that, of course, is the underlying goal of the test to stay. It's taking tests to stay. But is there I know the CDC wasn't taking the lead on this, but was there a collaboration of states doing this?
Not so much. So one of the earlier states that did this was Colorado, and they published a paper on how it had gone. And so I'd reached out to their state epi at the time and just got more information. And so that was part of the information that went into how our planning went. But now there are, like you said, there's a number of states that are trying this. As far as I know, there's no convening group of sharing ideas or anything like that. I don't know that they're doing it through the Rockefeller school safety. I stopped tuning in on those calls.
Well, that's okay. I got your back. That actually was where I was learning about this, and learning the sort of state leaders who are doing this. But you're right. Every state is doing this a little bit differently, and that's sort of the point. Was this has to be flexible to meet the needs of a given school district, given that every school district is so different.
Marcy, I might just say, as far indicated, when you really step back, which is hard to do because we're all right in the middle of this right now, you step back, this has been a home run. From where we were, probably 6 months ago, 7 months ago, where almost no one really wanted to test, to where we are today, and the amount of instructional time we are saving, and the number of schools that we are able to keep in session. When you really step back and look at that, even though we're talking about trying to get everyone in and the small percent that hasn't responded, overall this has been a home run, and that's attributable to KDHE and the flexibility that they've reached out to 307 units, 286 public, and another handful of private districts, and said, tell us how you want to do it. Tell us what's your purpose, and then they've tailored that to it. So I want everyone that's listening to this to know we have been able to keep school going primarily because of the testing program, and as it gets better, I think we'll even have more success in doing that.
That is a great point. I did just see a statistic yesterday that on average, 18% of schools are testing. So Kansas is well ahead of the curve. And I think that's also a testament to how closely they've been working with you, Randy, and all of your colleagues, superintendents, school boards, et cetera. Stephanie, I know that we're asking a lot of sort of school questions, and this is the safer school, but from a clinical perspective, one data point that I'm learning and would want everyone here to be aware of, you and Dr. Bakani McKinney participated in a press conference around this. Hospitalizations, big picture, adults slowly but going down, but the number of pediatric hospitalization continues to go up, and to go up pretty rapidly. And so there's obviously a connection between school opening and cases among kids and subsequent hospitalizations. And so don't know if that was something you wanted to explore a little bit more with this group.
Yeah, I think that's certainly a great discussion to have, is kind of what people are seeing. Certainly here in Wichita, we're seeing more pediatric hospitalizations due to COVID. And certainly that has exponentially increased after school started. We've had more in August and September than we had the entire pandemic. And I'm sure Dr. Hubbard can speak to what Children's Mercy is seeing as well. So definitely seeing more. The other thing I've seen even this week being on service is younger infants who are hospitalized who have school-age children. So it's definitely spreading into other family members as well.
I'll just add on the outpatient side of things, we're just seeing so much illness, I guess, just a lot of RSV, a lot of rhinovirus. And so, I mean, these are also things that can be spread less, or we can stop the spread with masks, and we still encourage our parents to test, because we can do full respiratory panels. So we know, hey, it is RSV. So, there are different guidelines for things like that. So we're trying to educate our families out there. Please test, no matter what, so we can figure out what your child has, and we can treat them accordingly and then plan accordingly how we're going to get them back to school.
And I am getting a view of all of you here. There we go. A question that the pediatricians and family physicians are in a unique position to answer, but I'm really curious about what the school nurses are seeing is a connection between those school districts where masking is happening. Do those tend to be school districts where we've got good rates of vaccination, or is there no correlation? And the reason I ask is we're obviously going to need to work together when the vaccines roll out for kids ages 5 to 12. And so, Kimber, I see you nodding your head. You and Kelly, if you've got some feedback for the rest of us here.
Right. This is Kimber Kazitz, and we switched to doing mandated masks on August 30th, and we're also continuing to try to get our students age 12 and up vaccinated with the COVID-19 Pfizer vaccine, partnering with our health department. We're really looking forward to when that age lowers. But we have seen a lowering in the number of total positive cases since we mandated the masks. I mean, we still have cases because it's in our community as well, but we are seeing that decline, and we're tracking that. So for those that are wondering if it's making a difference, it certainly is making a difference. And the big piece where we've seen it make a difference as well is that if we have them wearing their masks, we have low risk contact. So then we're not testing those kids. So, and the contact tracing piece took hours at the secondary level to try to figure out, well, in hour 2, who was wearing their mask and who wasn't, in hour 3. So it's really made an impact on the workload. It's made an impact on the contact tracing and being able to follow up efficiently. So the mask did more than just stop the spread of cases so rampantly. It also minimized the contact tracing effort, because we were looking at the students or staff where both people were wearing a mask is low risk. And as long as they're asymptomatic, they're good, monitor for symptoms that 14 days. So we are really seeing a huge impact. And I want to share that the testing that we're doing in our schools, it's been a heavy lift. I won't lie. It has been a heavy lift, but I have seen a lot of collaborative teamwork come together, and we're continuing to come up with new ideas. Who can we get to assist with this, come in early or stay late and things like that, and utilize other staff members to help out. But I would love to see that days saved that Dr. Watson was talking about.
Mm-hmm.
What I look at is, and this is just looking at our tracker today, that we had, since the beginning of the school year, over 23,000 high-risk close contacts, right? That's a lot. Some of them were, a lot of them were on the same day, but 216 of those tests that were done came up positive. So it was 1% that came up positive. And but we were able to stop that spread by identifying people that had been in close contact and that were positive, and kind of stop the ramifications of the trickle down effect of that. It really is making a difference. It's also making a difference at our schools to be able to test students that have some of those minor symptoms that could be other things as well, like congestion, runny nose, headaches, stomach aches, those kinds of things. We're able to quickly identify those as well. And out of the symptomatic staff or students in the schools that they're testing, 2% of those are coming up positive. So, and we've done over 3,000 within the school there. And then we have our testing site at the district location as well. But we're seeing these mitigating measures make an impact.
That's so good to hear. So good to hear. Kelly, did you want to add anything?
No, I think I was just agreeing with Kimber facially.
Well, Farah, I wonder, given that so much of this work was sort of hatched by you and your team, are there burning questions that you have now that you can hear direct feedback on how it's going?
Not necessarily right now, but I think that I definitely want to hear, and we've worked closely with Kimber because she's great at sharing her lessons learned, but more kind of lessons learned so that we can also help other districts kind of, hey, somebody else tried this and it didn't work. So, maybe try this first. That's always helpful. Kind of like you were mentioning, more of a learning collaborative. I know we tried that. Well, we did pretty well with that over the summer with the 11 districts that we're piloting. But now it might be overwhelming to put another thing on people's plate, but at least I think that everyone learned a lot from each other over the summer.
Is there a possibility to, even have a listserv or something to connect to those districts so that they can share successes or pitfalls? I know you guys you have people out there to help, but it may be like, like Dr. Clark and I are in very rural communities. Sometimes it's nice to say, hey, it worked for us in our community. Who else is out there that's this size, and what did you do? Is that a possibility?
I think we could probably look into that, right? Like what the most reasonable solution would be. I think there's a ton of value to just learning from other people who are going through the same thing.
Yeah, absolutely. Is there any role to, and forgive me for asking this, I'm just sitting here thinking on some of these smaller districts that may be less resources, is there any role for this committee to help with any kind of data collection or assimilation or anything? I don't know if that is really, it's not really the focus of this group, but is there any way that we could help make the burden, I guess, easier on them?
I personally don't think that's necessarily your role in this group, but certainly if you hear of districts that are struggling and for whatever reason they just have ignored us, or they didn't think, or it was just going to be too hard, we can definitely double, triple our efforts to work with them. Or if they are doing a testing plan and are struggling and are wondering about if I should keep doing this, we'll definitely go back to them and say, do you need more resources? Like Randy said, we can always adjust that budget.
And I do hear a kind of a recommendation coming out of this group that creating that collaboration, figuring out what that could look like, might be the first step in what we would recommend. I could imagine that would be useful again when we have vaccines for kids ages 5 to 11, just having a connected network. I know Randy is connected with all the schools, but this would be sort of the subset of folks who are working specifically on these issues.
Marcy, one question I have for the group would be, well, actually, I would probably start with asking you first, but how is it that the schools actually report, whether they're masking or not, like what they're doing? And then I guess my question to the group would be, how do we get our school districts to report frequently? Because we do know that things change, week by week, day by day, really. How do we make that a very simple process for the schools to communicate with us so that we can have even better data, so we don't have this big void of, unknown, what are these schools doing? So yeah, I guess to start with, how are they doing it now? And then for everybody, how can we do it better?
I can actually start with how we did it last school year and what didn't work. So last school year, we did have a weekly survey. It was an online survey that essentially asked about, mask policies for students, teachers, staff, visitors, and absenteeism. So it was the school absenteeism survey. Terrible response rate. The data was essentially not usable at all. So we decided not to do it again this year. And the primary responsibility for reporting, we were sending it to the school nurses. They could obviously assign it to someone else because it was just an online survey, but they just had so much going on that they couldn't.
So far for this year's, the information that we're sharing with all of you now is a survey that we send to schools that is basically just 5 questions, really trying to keep this pretty simple. I don't, is that sort of the reporting structure for this year, Farah?
Yeah, and it's not being reported to EPI. As my understanding is, I think maybe from someone from BCG, it was kind of a one-time grasp of trying to kind of level set what is your mask policy now. The reason we tried to do it last year on a weekly basis is because they would change, right? Lots of schools started off with like nothing, and then very quickly started having to implement something to, okay, it was required for some students, or then it became required for all students. So the data changed so much, we felt like we needed something more than just a cross-sectional one time. But like I said, the response rate was so bad. I think what we're trying to do now, sorry, Marcy, I think what we're trying to do now is those program specialists that are working really closely with the schools, we're collecting data from them because we're having constant conversations. We are asking them, but that just gives us a snapshot of the ones that are participating with us in testing programs. It doesn't tell us about the rest.
So maybe a second takeaway that can come from this group is to look at states who seem to have a pretty good reporting structure to see what's working for other states. By the way, the Rockefeller Initiative that Farah mentioned is chaired by Atul Gawande. So I do like to have a lot of questions for Dr. Gawande. So keep them coming.
How about from the rest of the group? Are there other questions with the metrics or the topics that we've talked about so far? And I think Kimber asked in the chat, who is the contact at each school district to report the information? Is that still the school nurses?
Yeah, for the program specialists, we've been working closely with the school nurses and the principals primarily, or the superintendents, that's who they've been working. But like I said, then there's that whole group that we're not working with yet. I'm so hopeful.
And then Dina asked about how to manage misinformation. Man, that's a tough one, isn't it? But any thoughts on that? Who we can partner with, or from anyone in the group really, to manage misinformation?
I'm wondering if the physicians here who are a part of this work group saw the joint letter that came out from the American Board of Family Medicine, the American Board of Pediatrics, and Internal Medicine. For those of you who aren't familiar with those organizations, they are all certifying boards. And so they are in a position to certify or decertify, as it were, physicians based on their board status. And I was very impressed that they overtly took on misinformation and said, this is literally a lack of and correct me if I'm wrong, and Dr. Kuhlman, it looks like you're very familiar with the letter, but basically this is a lack of professionalism. Is that sort of the rubric under which they were assigning issue?
Yeah, I think so. It was, there's certainly a joint statement just discouraging physicians from sharing misinformation that's exactly what you said. So, which I thought was actually really good. I don't know, we've been in collaboration with the local governing authorities here, and maybe that, I don't know if doing something at like local Kansas state level with KMS and KAP, KFP, if it's worth doing a similar joint statement at the state level with our medical organizations too. I don't know how impactful that would be or not.
I think it's a great point that maybe we could do locally, because you're right, Marcy, the fact that these organizations that certify physicians as board certified in pediatrics, family medicine, internal medicine, came together and said, this misinformation is so deadly that it is unprofessional, unethical. We are first, do no harm. And so if you're spreading misinformation about the COVID pandemic, you are doing harm, and we are going to hold you accountable with your medical license and certification. So I think that is a big thing, especially for 3 large specialties and the primary care specialties. And so I would be in favor of our organizations here in Kansas, at least having that discussion.
And I think flagging that for the executive directors of those organizations, but maybe other healthcare organizations as well that go through a certifying process, that it certainly would send a message about misinformation, and misinformation is just really so rampant right now.
Well, Marcy, the good news is that you've got presidents of the KAFP and KAAP on this call. So Dr. Clark and I will take those back to our organizations to talk to them about it.
And hi, everyone.
Very convenient. Sorry, Joan.
That's okay. Joan Duvey, I'm a family doc, and I'm the Deputy State Health Officer at KDHE. And I just wanted to chime in to this part of the conversation in particular, because this is especially damaging when we know statistically that people listen to their doctors more than they listen to anybody else. So if what they're hearing from their physician, their healthcare provider, is misinformation, that's what they're hearing, period. And so I think that it's very relevant to the conversation you were just having, but also relevant to the what can we do and how can we prevent misinformation. You guys have an extremely powerful voice, and people will listen to you. And so just, how you channel that to combat this misinformation could be really, really helpful. And thank you.
Yeah, thank you for
that. Randy, do you feel like the superintendents that you're dealing with are all pretty connected with their local family physicians, pediatricians? I could see sort of a mutual support society when they're in a community where misinformation is being spread.
Yes, they are very connected, both with their local family physicians, if they happen to have pediatricians in their community, and then their county health officers. But I can just tell you that there's many communities that don't have any physicians in that community. So they're relying on county health officers. And as you know, throughout the last 18 months, those have changed a lot in our rural parts of the state. And so every time that changes over, there's different information that often gets transmitted to the local school boards. And that's created some changes in policies. So, you all were talking about masking. I can just tell you that changes every week because of just how local boards interpret what the county health is telling them related to viral outbreak at that minute in that building. So that's just an example. But they're very connected, Marcy. But the turnover in county health has also turned over messaging in a lot of those rural areas, particularly.
Yeah, I working with KDHE and the local public health officers. Yeah, they're sort of the unsung heroes behind the scenes who are kind of the first to get beaten up. And I guess that was in part the reason I asked the question, there's power in numbers. So what can we do to be supporting them, particularly from a healthcare leadership perspective? Christy, Dr. Clark makes a really good point that, we've got the Board of Healing Arts in Kansas that oversees many allied health professionals, and it probably would behoove us to also do outreach there and see if maybe they'd even be willing to play a role, because it wasn't just the docs who came out. It was also the federal state licensing board, that their association also came out in opposition of misinformation. Yeah, that's a great idea, Christy.
I'm wondering if there are local partners, faith organizations, community organizations in some of these areas with very low vaccination rates, less masking, that we could partner with so that somebody from their own community that they trust could help spread this message.
Yeah, it is a great suggestion, and I certainly don't want to steal the thunder from the KDHE folks. The outreach that is being done through the faith community is happening on a couple of different fronts. I know some of you have recently been tapped around communications. Soon you will see Dr. Mills starring in a theater near you, among others. To Joan's point earlier, knowing that healthcare providers are so impactful in terms of messages that folks listen to, but the data also tells us that faith leaders and local leaders are really important. So we're also doing some testimonials that will use those leaders. I know we have long been trying to work with the faith community around, I shouldn't say been trying, I know we have been, around testing and vaccination. And I don't know if Farah or Joan or Sherry want to speak specifically to that. I know Dr. Jimena Garcia, via our equity initiatives, is certainly working with faith communities.
Yeah, we have a great collaborative effort with the United Methodist Churches, and I think there are somewhere between 500 and 600 across the state of Kansas. Many of them have volunteered to provide testing in their communities. Some of them were quite concerned to hear that there were schools that were proximal to them that were not engaging in testing and reaching out to ask how they could help. Could they partner with schools? Could they partner with communities to help schools do testing? For them, they're very mission driven, and they are just committed to doing what they can to make a difference in their communities. So if you have a UMC church near you, or are working in a community that has a UMC church, reach out to them, and we can help them with testing. Also, Dr. Garcia is working with them to provide vaccine as well.
And Dr. Hubbard, I feel like I need to get this in. One of the things that you have been doing to drive conversations in your own community that everyone I think has the capacity to do is opinion letters, meeting with local media and reporters. And it requires some courage to do that. My hats off to all of you who have said, this is the right thing to do. I'm going to put myself out there. And so you have been rising to the challenge. So thank you for that. And Dr. Coleman and Dr. Connie McKinney, Dr. Clark, it's been, I think, really, really important to folks in the local public health community to grow the coalition, as it were.
One thing I just might pose as a thought is, so being on the school board, it's not the most fun job, and we are tasking these 7-member groups with making big decisions. Now, I have no doubt that that everybody out there is trying to do the best for every kid. No matter what their opinion is, on any given day. I do believe that there's not a single person out there that doesn't want to keep kids safe. Yeah. Having said that, we have so many varying opinions on the different school boards, and we have districts, with different plans, different masking plans, different colors of phases and things like that. How do we best assist our school boards when they are either making these decisions to have mask mandates and then are maybe harassed about it, or our school boards decide not to have mask mandates, and then they are maybe harassed because of it? I mean, there are a lot of there's just a lot of people making important decisions, and then the consequences of each are really hard on the school boards. Now, I say that knowing that, again, there's a lot of science out there for masks. There's the science out there for vaccines and everything else. We would love for everybody to just be on board with masks and vaccines. I would love that. But even my own school district doesn't have a mask mandate at this point. So what is the best way to be a resource for our school boards to help share the science and get people to understand the science, and then make decisions based on that, I guess would be my question.
So Jen, if I may, can we take that as homework for the next session? Because I know we are at time. I know Dr. Watson has thought about this a lot, as we have, and maybe that we tee this up as a dialogue. Find some best practices where communication has broken some of the stalemates around this topic. Is that okay? I know everybody has probably another meeting or patient to take care of.
Absolutely. Sorry, I didn't. I'm on my phone, so I can't see the clock. So thank you.
No,
I think that homework sounds great.
It's a great final. The conversation is only just starting, right?
Yeah.
Mm-hmm.
I just might say this as you think about your homework. I think the message about vaccination, test, masking, that's very simple, right? Then attach the research to that in a very simple form. Vaccination causes this reduction in spread, causes reduction in hospitalization, reduction in death, whatever that is. Testing keeps this many kids in school. So as you think about it, I would frame it around those 3 areas. And then that keeps things simple. And then you repeat that message in every school board meeting in every community, and we can be a part of that. Kevin and GA can too.
Hey, Dr.
Marcy. Marcy?
Mm-hmm.
Okay, I have a question for you. How aggressive do you want to be? Because my suggestion is that, unfortunately, is that you're going to have to create some tension in some of these places. And as nice as we generally are, we say thank you, please, don't do that, and whatever. I think, you're going to have to probably put some pressure on these people that make bad decisions and let them know up front that they're going to be held responsible for the decisions they make. And I'm not talking about legal issues. I'm talking about the kids you just talked about who died in middle school because they got COVID, and I'm not above that, putting it right in their face, because I think that's the only way that sometimes it gets across to people that this is not a game. This is not, a political contest where we all going to go back at the end of the day and just lick our wounds if somebody loses. We're talking about somebody's going to die because of the decision you made. And it may not be you, but it could be somebody you love, or by any means it's somebody loved, so that's the other side of that. I'm not against being a little bit more aggressive. I'm not getting paid for this. So if they don't like me at the end of it, that's fine, so, okay. So that's the other side of that. Sorry.
Yeah, no, it's an important perspective, and certainly we know frustration at the local level it is coming from all sides. And so how do we get through without bad will, but achieving the goal of keeping our kids safe?
Yeah.
Guys, we are 4 minutes over, and I'm going to
Yeah.
leave it to Dr. Coleman to have the last word.
I'm just saying amen to the gentleman, and God bless you. And I totally agree. I'm a nurse with a bunch of areas amen. I co-sign what he said.
All right. I don't know. I wrote so many notes down of ideas and thoughts and things I feel like we need to work on. So I know I don't have any great closing words, but I appreciate your time. I appreciate everybody's passion on this, and certainly anything we can do to continue this message, continue our efforts. And I appreciate everybody's time for being here today. So I look forward to at least following up with some of my thoughts and ideas, and hopefully we can continue even offline working on some of these initiatives. So thank you guys very much.
Thank you all. And thank you, Dr. Mills, for putting the fine point on it. This is literally a matter of life and death.
Yep.
It is.